Donor site. Definition and importance in plastic surgery. In the field of plastic surgery, a donor site refers to an area of the body from which tissue, skin, or other materials are taken to be used in a reconstructive or cosmetic procedure. The donor site plays a crucial role in achieving successful outcomes, as it provides the necessary resources for repairing or enhancing a specific area of the body. Importance of donor sites in plastic surgery. Donor sites are essential in plastic surgery for several reasons. 1. Tissue replacement. Donor sites serve as a source of healthy tissue that can be transplanted to replace damaged or lost tissue in another part of the body. 1. This is particularly important in procedures such as breast reconstruction after mastectomy or facial reconstruction after trauma. 2. Enhancement. In cosmetic procedures, donor sites can be used to augment or enhance certain features of the body. 2. For example, fat grafting involves harvesting fat from one area and injecting it into another to improve volume and contour. 3. Compatibility. The choice of a donor site is crucial to ensure compatibility with the recipient site. 3. Factors such as skin color, texture, and thickness need to be considered to achieve natural-looking results. 4. Healing and recovery. Donor sites should be carefully selected to minimize scarring and promote optimal healing. 4. Surgeons aim to choose areas that can be easily concealed or have a natural tendency to heal well. Types of donor sites. There are various types of donor sites commonly used in plastic surgery. 1. Autografts. Autografts involve using tissue from the patient's own body. 1. Common autograft donor sites include the abdomen, buttocks, thighs, and back. 1. These areas provide ample amounts of skin and fat that can be used for grafting. 2. Allografts. Allografts involve using tissue from another person, typically a deceased donor. 2. This is commonly used in procedures such as skin grafting for burn patients. 2. Allografts require careful matching to minimize the risk of rejection. 3. Xenografts. Xenografts involve using tissue from animals, such as pigs, to replace damaged or lost tissue. 3. While not as commonly used as autografts or allografts, xenografts can be beneficial in certain situations. 4. Synthetic materials. In some cases, synthetic materials may be used as donor sites. 4. These materials can include silicone implants, mesh, or other biocompatible substances. 4. Synthetic materials are often used in breast augmentation or facial implants. Considerations and risks. When selecting a donor site, plastic surgeons carefully evaluate several factors. 1. Availability. The chosen donor site should have sufficient tissue or material to meet the requirements of the recipient site. 2. Matching. The donor site should match the characteristics of the recipient site to achieve a harmonious and natural result. 3. Scarring. Surgeons aim to select donor sites that can be easily concealed or have minimal scarring to ensure optimal cosmetic outcomes. 4. Functional impact. The choice of a donor site should consider the impact on the function and aesthetics of the donor area itself. While donor sites are crucial in plastic surgery, it is important to note that there are potential risks and complications associated with the harvesting of tissue or materials. These can include infection, scarring, bleeding, and changes in sensation at both the donor and recipient sites. However, with the expertise and experience of a board-certified plastic surgeon like Dr. Karan Chopra, these risks can be minimized. Conclusion. Donor sites play a vital role in plastic surgery, providing the necessary resources for reconstructive and cosmetic procedures. The careful selection of a donor site is essential to achieve natural-looking results and ensure optimal healing and recovery. Dr. Karan Chopra, a renowned plastic surgeon, utilizes his extensive training and expertise to choose the most suitable donor sites for each patient, resulting in exceptional outcomes. If you are considering a plastic surgery procedure and would like to consult with Dr. Karan Chopra, please contact us to schedule an appointment. FAQs about donor site. What is a donor site in plastic surgery? A donor site in plastic surgery refers to an area of the body from which tissue, skin, or other materials are taken to be used for grafting or reconstruction in another part of the body. It is typically a healthy area that can spare tissue without causing significant functional or aesthetic problems. How is the donor site chosen in plastic surgery? The choice of a donor site in plastic surgery depends on various factors, including the specific procedure being performed, the patient's individual needs and preferences, and the surgeon's expertise. Common donor sites include areas with excess skin or tissue, such as the abdomen, buttocks, thighs, or back. What are the risks and complications associated with donor sites in plastic surgery? While donor sites are carefully selected to minimize risks, there are potential complications associated with the procedure. These may include infection, bleeding, scarring, delayed wound healing, nerve damage, and changes in sensation or appearance at the donor site. It is important to discuss these risks with your plastic surgeon before undergoing any procedure.